Welcome to audio highlights for Chapter 7, Social Class and Classism. So social classifications are a system that is in place in our society that's used to assign social roles. So this, of course, isn't a system that there's an office of, or it's not an official explicit system, but it is a way that our society and our culture tends to designate, and other cultures as well, designates rank and power. So it may be based on variables, many of which we've already studied in this course, so gender, age, race, ethnicity, ability, knowledge, or education. And the class indicators, so what do we use to determine which class someone is a member of, are usually based around resources. So what's the person's income, their job status, what's their wealth like, where do they live, what do they wear, what school do they go to, and who do they hang out with. And in general, for our purposes, we're going to look at three different divisions of class. So we're going to look at lower class, middle class, and upper class status. And you can see kind of the differences in terms and the differences maybe in where someone lives, what kind of education they have, what kind of job they do, and what kind of income they earn. Another term that I know that you've heard is SES, or socioeconomic status. And this is basically a number or a variable that we use to compare different class standings in our society. And really, because we've found so many different disparities among people of lower SES, we've incorporated this variable into almost every study that we do. So in a demographic questionnaire prior to taking a survey or participating in research, you'll almost always see the researcher asking you questions related to SES. And the reason for that is that we know that SES is so influential that we consider it in almost any research question that we have. SES may not necessarily indicate wealth or poverty, and so before we go any further, just defining poverty is a condition in which a person is unable to meet those basic needs. So unable to meet needs like having a food to eat, having a good place to live, safe place to live, and having clothing to wear. Wealth, on the other hand, is just a substantial surplus, or having those resources and more. So having more than you need would be a definition of wealth. And it is possible to move between these two extremes, like between poverty and wealth, but SES is actually much more constant in that it's really a deep part of one's identity, because many times their whole experience in terms of education and where they've lived and who they've spent time with is embedded in this lower SES. So we know that as a counselor or as a human services professional, it's important to understand those differences across SES, across socioeconomic statuses, and also to be very aware of classism as it relates. And so classism is a group of discriminatory beliefs about and behavior toward individuals based on perceived or actual SES. And that perceived word is an important one, because that means that many times, actually most times, we don't actually know someone's job or income or where they live when we meet them out in public, but we may just use a few clues about what they're wearing or the way that they're speaking, and we may come to this assumption about their SES. And based on that assumption, we may treat them differently based on our own biases, or we may be oppressive or discriminate against them based on that. So, and we know again that internalized classism also exists in terms of when an individual may feel shame, or on the opposite end of the spectrum, accomplishment or superiority. So it's when our beliefs, values, decisions, and relationships are based on how we perceive our class status. And classism is a significant problem in our society that continues to divide different groups of people. And you may have recently heard the concept and the term income equality or income inequity is a big topic of debate in terms of the minimum wage and how many people are what we would call the working poor. So they have a job, they're working hard, but they still don't have enough money to meet those basic needs. And another largely ignored but significant problem related to classism is what we would call poverty attribution. So this is when an individual's race, gender, and religious affiliation influence people's beliefs of individual wealth or poverty. So these are, again, those assumptions that we have about what it means to be poor and to live in poverty. A major myth that this text and I hope to bust for you is that we actually live in a classless society. That's not the case. While we would hope for a classless society with equal opportunity for all, that's actually not the reality for most individuals. And class mobility, which means that the degree and how easy it is for people to move between these class levels, it actually varies greatly area by area and group by group. So that's not a constant. It is possible, but sometimes in our society we assume that everyone has an equal chance to move, and that's simply not the case when you don't start from the same equal playing field in the first place. We know that poverty has a number of mental health consequences. There's higher incidences of a number of different mental disorders. There's a greater incidence of trauma. You even have higher exposure to pollutants in the air based on where you live. So we know that this sets up a negative situation for individuals' development of mental health, which is why if you're working in the human services or the counseling field, you may encounter a number of clients who have been influenced quite negatively by poverty. The chapter goes over a little bit about the definition of poverty and who is poor. So currently the national poverty rate at this time, which I believe this data was collected last year, 2013 in this case, was about 15.1%. And then the 2010 federal poverty threshold, this changes a little bit year to year, was for a family of four, 22,314. So if you were a married couple and had two children, if you made less than $22,314, you'd be considering living under the poverty line. And a major problem that can come along with that level of poverty is food insecurity, which is actually a government term used to describe when families have limited or uncertain food availability, meaning that they don't know where they're going to get their next meals to meet their needs for hunger. So we know that there are a number of risk factors related to poverty and mental health. So we have education inequities, we have different employment outcomes that are generally negative as people their jobs become less stable, and poverty for some people is just one paycheck away. We also know that there are a number of negative implications in terms of housing quality and how difficult it is to find affordable, safe, and clean housing, especially on a very limited income. And we know too that there are a number of mental health consequences to poverty and to the classism that exists in our society as well. So not being insured is a significant problem because people can't get the treatment that they may need for mental health reasons or for physical problems as well. So how do we address classism in counseling? First of all, we know that low SES clients have the highest treatment dropout rates. So we need to be particularly open to their needs in therapy and really establish that rapport and listen to their perspective, and also be quite self-aware of our own biases that may be negatively influencing the relationship. We also know that some people, when they're focusing on very concrete needs, they may not be able to participate in very insight driven or kind of theoretical aspects of counseling. So to give you a very specific example, if I don't know where I'm going to get my next meal and I'm currently hungry and I don't have a safe place to live, I may not be very interested in sitting down with you to talk about maybe things like tell me about, your greatest goals for the future, or how do you think that you got to where you are today, or tell me about your self-esteem. All those questions are valuable, but when we're thinking about how hungry we are because we haven't eaten in days, or we don't know where we're going to sleep that night, it's very difficult to concentrate on those types of questions. So we know that our role as a multiculturally competent therapist is to develop, let me skip back here a second, to develop an awareness, because we don't want to have that cognitive dissonance continue where we just kind of notice a mismatch between our beliefs and our behaviors and our thoughts, and how we don't resolve that information is we just kind of merge them together and believe that we are kind of seeing what we think we're seeing. It can be hard to come to terms with the negative experiences that many, especially children, face in poverty in our country. And so we want to develop that awareness, which is the key, the first key to becoming multiculturally competent, especially in dealing with classism. We also want to develop that knowledge, and I mentioned it can be hard to hear some of these things, but it's important. And last, we want to develop those skills. So we want to do a very thorough initial assessment of a client. I'll tell you that clients that I've worked with in the past and clients in general, they don't enjoy being asked questions about their income levels. So you have to ask those questions with respect and dignity. And there are actually a number of other ways that you can get a more accurate feel on what an individual's class experience may be. And then also an open, honest conversation about the effects of oppression related to one's class can be extremely valuable too. And lastly, recognizing, as I mentioned, that it may be your role as a human services professional to help that individual find resources to meet those very basic needs, especially if you want them to go on and benefit from other phases of therapy.